Good morning, Professor Ferdinand. Can you tell us more about the risks related to high blood pressure?
High blood pressure or hypertension is the leading cause of death throughout the world. Hypertension is directly related to cardiovascular disease, that's heart disease and strokes, with a 10-year risk of dying. It causes heart attacks, strokes, heart failure, kidney disease, peripheral arterial disease, and a wide range of heart and vascular conditions. So perhaps the most important thing we can do worldwide is control blood pressure. When it increases 20 millimeters of mercury for the systolic or the upper number, 10 millimeters of mercury for the diastolic, it doubles the risk of having heart disease, stroke, or dying.
ACC/AHA issued new guidelines in November 2017. Could you please describe them?
They now suggest that hypertension starts at 130/80 millimeters of mercury, 130 for the systolic or upper number, 80 for the diastolic or lower number. All patients who have an increase in blood pressure need to first start with lifestyle, exercise, weight loss, low-salt diet, increase in fresh vegetables and fruits. However, if the 10-year calculation of risk is greater than 10%, that's having a heart attack or stroke over the next 10 years, then pharmacotherapy or drug therapy is needed. The first drugs that are recommended include thiazide-type diuretics, calcium channel blockers, ACE inhibitors, and angiotensin receptor blockers.
Are all Americans individually equal facing hypertension?
Across the population, there are some decreases and increases in the rates of hypertension depending on ethnicity. For instance, African Americans have higher rates of hypertension. Across all of the various ethnic minorities, including African Americans, Hispanics, and Asian Americans, blood pressure control is less. So in the populations who self-define as African American, there tends to be an increase in hypertension, more complications from hypertension, more salt sensitivity, and more difficult to control hypertension. In that population, the new guidelines suggest starting with a thiazide-type diuretic or calcium channel blocker. There have been studies that have shown ACE inhibitors and angiotensin receptor blockers are less efficacious. In other words, don't do as well lowering blood pressure in those populations. So we're looking for ways to control blood pressure in ethnic minorities, specifically African Americans.
What could be the contribution of the new molecule developed by quantum genomics?
Quantum genomics has a molecule which may be beneficial in African Americans and other racial minorities who are sensitive to salt. If you look at this molecule in the animal models using the rats, those which were salt sensitive appeared to do well with the quantum genomics molecule. Perhaps in our clinical trial we can show that lowering blood pressure is efficacious in those patients who may be salt sensitive. That includes African Americans and other ethnic minorities, especially with overweight and obesity status.
Thank you so much, Professor. Goodbye.